So good morning, and I'd like to welcome everyone here to this Partners in Technology briefing this morning that's focused on the changes underway within the Queensland Department of Health. So my name is Paul Russell. I'm the General Manager of Digital Economy within the Queensland Government, and on behalf of DeCity, very pleased to be able to welcome you all here this morning to this Partners in Technology session. Before I introduce our two presenters this morning, in Mel Thatcher, the Chief Health Information Officer, and Colin McCreerick, who is the Chief Technology Officer, I just want to say a couple of words about a new initiative which DeCity has launched. A number of you would have come to the session in February where Sue Rickaby talked to us about an ICT industry engagement plan that was underway. Work's well advanced on finishing that plan. We've had a good response from industry. Around about 150 firms responded to the online survey, giving us feedback about the draft. And also we had some sessions in Toowoomba and Townsville, which were well attended by local industry representatives up there as well. So that plan is being finalised, and in the near future it will be launched to yourselves as industry, and then we really want to get on with actioning that plan going forward. But one of the interesting new initiatives is the innovation portal that's now live, been launched by our colleagues in the Strategic ICT division of the department, and we're encouraging local industry now to visit that portal and register your interest in receiving a flow of information from us and from you back to us about our ideas. So some of you would be familiar that we have had a pilot government innovation hub running with PricewaterhouseCoopers leading the way on that, and there's been 2 rounds of activity. Some of those projects are now starting to reach commercialisation or market readiness. But this is another step forward. This portal is designed for two-way interaction, for government to put out there some of the problems and challenges that it's facing, either at a whole of government level, but probably more specifically at an agency or business level, business unit level, and to seek views and ideas from the marketplace, and also for yourselves from the marketplace to input your ideas as to what you would like to see improved or strengthened in government. So Richard Tomlinson, who's the change manager who's introduced this new initiative, is here this morning. But so I encourage you to have a look at that if you would. Okay. The other thing that we have done, and I would encourage you to have another look at this as well, we've actually redesigned and refocused our social platforms. So we've launched Digital Queensland, relaunched Digital Queensland in Facebook, Twitter and YouTube. There's a fair bit of stuff, fair bit of content going on the YouTube video channel for you to also have a look at. So if you haven't signed up to particularly Facebook, I would encourage you to think about it, even if it's just for business reasons, because that is going to be a big channel for communicating events, news, etc., in terms of what's happening in the digital space within the government. Okay, so let's focus on what we're really here for today, which is to hear from 2 very senior people within the health portfolio about the significant new directions that health is about to embark upon. And to do that today, we have Mel Thatcher, who's obviously well known to most people in the room, I would suggest, who is the Chief Health Information Officer, and we've also got Colin McCreerick, who is the Chief Technology Officer of Queensland Health. So the general format is that both gentlemen will give us an update this morning on new operating models that are being put in place, and an introduction on different procurement methodologies for significant ICT projects to be undertaken within the health portfolio, and also to announce an interoperability request for solution, or an RFS opportunity for local business. So let's kick off, and our first speaker and presenter this morning will be Mel. So Mel commenced his career in the IT sector back in 1982, before the internet, and as an employee of the Queensland Government. And Mel left the public sector in 1988 to commence a consulting career in the private sector, including establishing his own very successful software and services company in Brisbane over a period of 12 years. Then in 2004, he joined the Mater Health Services as their Chief Information Officer, with executive responsibility for the strategic stewardship of the Mater's information assets, which aren't insignificant in this state. In 2012, Mel had his portfolio expanded. He was given executive responsibility for Mater's physical assets and facilities, including building services, engineering, capital works, property, and ancillary retail activities as well. Then in 2014, he jumped back into the government again as our chief, enticed back into the government as our Chief Health Information Officer. So the Office of the Chief Health Information Officer is responsible for providing Queensland Health with strategic ICT leadership in support of Queensland Health Blueprint, which is better healthcare for Queensland. Now, I won't go into his educational background, but I think he's a glutton for punishment, because it says here that he's undertaking a PhD in IT governance in his spare time. So please join me in welcoming Mel to address us this morning.